NIR, or near infrared, can penetrate the skin from a few millimeters up to 100 millimeters, which is 4 inches. You're watching the Daily Dose of Hue Light web series, and I'm Dr. Mitch, the Chief Medical Officer. And be sure to like and subscribe and always stay notified, because when we release new content, we want you to get it right away. Near infrared occupies 0.7 to 1.4 micrometers. Mid infrared sits between 1.4 and 3 micrometers, whereas far infrared is 3 to 1,000 micrometers. The difference of near infrared, mid, and far in the invisible electromagnetic radiation spectrum is based upon wavelength. Only one of this spectrum can produce what we call PBM, or known as photobiomodulation, which I'll explain in a minute. Near infrared falls into the category of an LLT, or low-level light therapy. NIR, or near infrared, can penetrate the skin from a few millimeters up to 100 millimeters, which is 4 inches. Less, by the way, than 100 milliwatts per centimeter squared, which is power, does not heat tissue and therefore does not cut the tissue like a laser. At 3,000 nanometers, or the far infrared zone that we discussed a moment ago, light is picked up by the water in your skin and it creates heat and it makes you sweat. It's not called far infrared because it goes deep in the depth. It's called far infrared because the far end of the spectrum. Irradiance, which is extremely important to understand, is the amount of light or distance that gives you the power in something we call joules. And you can imagine it to be able to penetrate the skin if you have enough power, and thereby create molecular changes as photobiomodulation in the near infrared spectrum can do. Now, we need 3 things for it to occur simultaneously. They are the amount of irradiance or brightness, the correct wavelength, and the distance to the body. And by understanding this, we can look basically at the sun. Solar irradiance is typically around 20 milliwatts per centimeter squared during the day. In the peak solar area, goes up to 40 milliwatts per centimeter squared. And you should be aware that 40% of sunlight spectrum is near infrared for a good reason. Think about if there was a bed of lights encompassing a bed, of course, of the correct wavelength, the right amount of LEDs, it probably could accomplish this particular task. So with 38,880 LEDs, this type of array can accomplish that irradiance of the peak solar irradiance of the 40 milliwatts per centimeter squared. Therefore, yes, we can reproduce what the sun can do. The French neurologist Nogier founded auricular acupuncture. Auricular acupuncture is basically seeing the ear as a mini whole body, and it's very well accepted in acupuncture circles. He also recognized that when you're first put together, basically sperm and egg, and you develop that morula, there are 3 germ cell levels, which include the endoderm, ectoderm, and the mesoderm. And from these 3 levels, everything that you are, from hair to organs to teeth, etc., they come from this. Now, these tissues, he found, resonate a special frequency as the fetus begins to grow, and that's how the fetus stays healthy as it grows. So when tissues as an adult get damaged in any of these 3 areas, by reintroducing these areas to its normal early resident frequency, the tissue can heal itself quickly, Nogier says. And these frequencies are in hertz, and they're pulsated, not used as a continuous frequency, since he found that when you pulse these frequency, it does seem to initiate healing. He also found that these frequencies can stimulate cells, decrease inflammation, improve circulation, improve lymphatic drainage, and of course, even help brain healthy activity to reoccur as well. These Nogier frequencies, when they're combined with near infrared simultaneously, create not only a synergistic, but an augmented serious effect in a very positive way for our patients. When I treat a patient with near infrared, I pretty much always include simultaneously the full spectrum of these frequencies. Patients such as those that have coronary artery disease pretty much all require the reestablishment of the microcirculation, which you've already learned that near infrared does readily, and also help the tissue damage, where, for example, the circulation is repaired, but it innervates the heart and other tissues. We need to renew them. So the Nogier frequencies may be our perfect answer with this. What I do is I combine this also in cancer patients. Pretty much all cancer patients have inflammation and they have poor circulation and poor perfusion to the organs, where the mitochondria, of course, are no longer functioning. Remember, the mitochondria, these small powerhouses in every single cell of our body which produce ATP, when they're not working properly, can initiate cancer growth. Now, as we noted in an earlier installation of infrared, we found the spectrum can promote cellular and tissue health. Add now the Nogier frequencies simultaneously, and we find remarkable cellular, tissue, and organ enhancement. Basically take any disease entity and it can seriously be improved and directed towards optimal health with the use of near infrared and the Nogier frequencies combined, let alone all the other adjunctive services that we use, from medications to natural medicines, etc. Thank you so much for watching this series. I'm Dr. Mitch GHEN.